Okay, hi everyone. Welcome to our 45th session of the MedAI Group Exchange. This week, we have Xiaoyuan Guo with us to present her research on facilitating the curation and future analysis of annotated medical image across institutions. Xiaoyuan is a computer science PhD student at Emory University, working with Professor Imam Banerjee, Professor Hari Trivedi, and Professor Judy. Her primary research interests are computer vision and medical image processing. She is experienced in medical image segmentation, out-of-distribution detection, image retrieval, unsupervised learning, etc. Thank you so much, Xiaoyuan, for joining us today. Before we start, could you tell us your preference on how you want to take questions?
Sure. During my presentation, any questions are welcome. Just feel free to interrupt me and ask the questions. I will try to answer as soon as possible. Yeah.
Okay, sounds good. So as always, let's try to make this session as interactive as possible. Without further ado, let me hand it over to Xiaoyuan.
Okay, thanks for the introduction. Very nice introduction. Hello everyone. I'm Xiaoyuan Guo, and this is today's topic is more about my PhD thesis topic. So this is a part of my topic, which is facilitating the curation and future analysis of annotated medical images across the different institutions. So let me go into the detail. First, so this work is mainly about dataset curation in medical area. Now, to introduce this topic, I will have three main parts being involved. So first one is shift data identification. The second one is shiftness quantification, which is to measure the shift data. Then we will talk about how to do future shift data analysis. So for shift data identification, which means that with an internal dataset as a base dataset, as a standard dataset, and then we want to detect the shift data among the external datasets without any data sharing using unsupervised anomaly detectors. And for shiftness quantification, we have to measure the shiftness of the identified data with the indirect and the direct evaluation metrics. Then after we have detected the shift data, we may want to help the domain experts to do future data analysis, like query, inspect, and analyze the shift data. So I will go to the first part with some introduction first. So as we all know that medical imaging has played a very important role in different clinical applications, which includes detection, monitoring, diseases, diagnosis, and treatment, so many applications. But deep learning approaches have been very popular for medical images analysis because it's powerful performance. But training such deep learning models often requires large amount of annotated data as supervision. For example, if we want to do a segmentation task, we need to have the mask annotation. If we want to do the image classification, disease classification or localization, we need to somehow have the location information or the image level classification annotation. But it is often that we have some data insufficiency problem because in medical area, especially for the annotations, those annotations are really hard to get because we may need a lot of energies and costs and human being involved. So it is often we have this problem, and if we can solve the problem, that will be great. Usually, as the deep learning becomes more and more popular, some hospitals also have their own small annotated data sets locally. So if we can create such scattered data set, it will be very beneficial for current deep learning or AI models learning. So my goal is to facilitate the curation and future analysis of the annotated medical images across different institutions. So why we want to do shift data identification, which is detect the underrepresented data, noisy data. The reasons are like, first, we may have inconsistent annotation criteria across different sources. And then the image quality can vary a lot. So maybe they have different rotations, they have different brightnesses, they have different image contrast. So those may affect the deep learning models' performance. And then we may also have some unexpected data type, which are totally outliers or something else we want to exclude from the data set. So that's why we want to detect the shift data. And here are some examples. For example, we have these 7 classes as our internal data set, and we have those samples look like this. And if during or in some other places, we may have some data looks like this. So this is also a hand data. You can see here. This is also hand data, but these hand images, they are very different regarding the intensity and also the contrast. So we may also have some other X-ray images like knee and chest images, but the chest X-ray, but they are totally unseen in those internal data set. So if we have some missed data in our external data set, we somehow should have found those differences or detect those shift data. And it is, although it is not very often, but it also can be possible that we have some more unexpected data, like skin cancer images or birth images. Those are very different image types. And this can be a bird image, just natural images. So when we do the model deployment, we may have some those different inputs. Those will affect the model performance. So here I'm trying to define this shift data. So the shift data here we talk about actually it is also called auto distribution data. So to identify those, we first try to classify them into 2 categories. So the hand and knee and chest regarding the internal data, these are the intra-class OOD data, while the skin cancer bird images are totally inter-class OOD data. So for intra-class OOD data, the OOD data is also known as the novelty data. Those can be some data from the same class, like for example, this hand data from the same hand class, but they are with different quality quality issues, or they are from the same category, like they are all like those knee images and chest X-ray images. They are just from the same X-ray body parts, but they are not seen in the internal sources. So they are also intra-class OOD data. For those those data from very different categories, those are called inter-class OOD data. And so to identify the shift data, there are some challenges first we need to address. First is that we should learn the dense representation of a data set. So because we are caring about the data set level information, so we want to somehow learn the representation of a data set. And because it is very difficult for the hospitals or institutions to share the patient private data, so we cannot access any we assume we cannot access the external medical data set. We just cannot access them. So we want to do this by first, because we cannot access the data directly, we can exchange the models instead of exchange the data. And we want to utilize the CVD model, which is an anomaly detector we proposed before, and I will introduce the details later. And with the anomaly detector to learn the in-distribution data of the internal data set, and then identify the underrepresented shift data in the external sources. So the model will be trained only on the internal data set, and then we will share the model to the external sources. So this is the pipeline. We have some. We first have an internal data set, which is a clean and standard one. We assume that the data set has several classes. For this case, we assume the data set has n classes, and for each class, we train a corresponding anomaly score, anomaly detector to learn the in-distribution of this internal class. And this anomaly score will model this anomaly of those internal class with each sample anomaly score. And then after training, we will share all those anomaly detectors to the external sources on the dataset B, and then with that we will get some anomaly scores for the anomaly scores for each sample of the class-wise data sample. And for the clustering part, I will talk about them later. So those just these three are just for the shift data identification.
I have a question on the previous slide. What do you mean by dense representation?
Dense representation means like a probability representation, maybe. So that will be much easier to understand. Instead of learn some like a very general representation, we think like we can model them with a probability model, and then we will expect that the model can learn the distribution with some hidden probability optimization. And then with this, we will hope that the external sources can be close to this distribution as close as possible. The dense means that just maybe good and can formulate the presentation like the representation.
Okay.
Is that clear?
I was thinking more of like dense versus sparse. So is there a reason why you would say it is dense and not just representation of a data set?
Dense means like a regard. If you think about like the data set size, the representation is actually not that large. It's kind of condense some like class-wise information. Like we may have thousands of samples, but the model will use some like a smaller dimension representations with smaller dimensions to learn the in-distribution, and we will use the dense representation to to formulate such data set distribution information.
Okay.
Yeah. So probably like in the architecture part, we can dive in more, and then probably you will just ask me if you still have some the questions or concerns.
Thank you.
Thanks. So with this shift data identification pipeline, so we can do the detection, we can detect the shift data. And so now I'm trying to introduce this part, the anomaly score part. The model I'm using actually is the CVD, which is the cascade version of autoencoder based anomaly detector. So this one is anomaly detector is aiming to consider both the intro and inter-class OOD data, and it will so because previously we proposed an anomaly data that are using data augmentation like transformations, and we think that for this one, we want to see up the time and also the energy to do something similar, but without any many complex steps. So with the cascade version of autoencoder to formulate the feature, we can learn the feature level discrimination to enhance the generalization. I will talk about this. Like this is the architecture here. We first have the original image. This is the end distribution data. We think this the input data is good and it's clean. So we will put this image to the first autoencoder part version of autoencoder. And then with this one, we can get some reconstruction here. And we will use a set of parameters to formulate the hidden, like the latent parameters. And with this one, but you can see here actually, if because we have some, it's kind of deep, and we want to learn some high-level information. So the reconstruction is very blurry. So we also add a branch here, try to concate the intermediate features from the encoder part, the first half encoder part, and also the decoder part, half of the decoder part, and try to concate them and treat them as our input into a branch variation of autoencoder. And so this will be our input, and then we also formulate the another set of latent parameters to formulate the low-level information, and then we'll got some reconstruction at the same time. So we optimize them together with those two branches. So we finally adding them together and eventually got the reconstruction. So S is the original input and S pra is the output reconstructed one. And we treated this the reconstructed one as the fake auto distribution data, because it's kind of like a GAN model, but we don't actually train the generator and the discriminator in the same time, because it is with the version autoencoder, we sometimes may have some like unstable if we train them together. So that's why we separate them train. And then with this reconstruction loss and also those discrimination loss, we finally got our anomaly score. So this original image will be the end distribution data. This S-pra will be the auto distribution data. And they are all put to the discriminator, which is a binary classifier, and then try to predict whether it's a real image or a fake image. And then with this anomaly score, we can see we first, because we want to balance the two parts for the contribution of the final anomaly score, we first normalize the reconstruction error in to 0 to 1, and then just have half of the value of their sum. So this is our final anomaly score. And we use this model to train to learn the end distribution data, because we use those latent with Gaussian distribution parameters, so we can learn the latent representation. And somehow we'll get the final. We will learn the differences between the internal and external sources. So here are some intermediate results. I'm showing the first one. This is a model dataset. If you are not familiar with this one, this is an X3 image dataset with those 7 classes included: the hand, forearm, finger, shoulder, elbow, wrist, and humerus. And by treating, so we are experimenting with the Emory as the internal dataset, and Stanford model dataset as the external dataset. So you can see here for the x-axis represents the anomaly score, and the y-axis represents the how many samples are with score in this value. Although so here, so in the model design part, we when we do the model evaluation on some public data sets, we normalize them together. We normalize them to 0 to 1. And because in our internal training, we have no idea about the outdoor distribution data, so we simply adding them together, just changes the normal score a little bit, just adding the reconstruction error and the discrimination error together. So that's why the normal score is larger than 1. So, but you can see the data samples with larger normal score means it is with higher differences from the in-distribution data. And so I'm also showing you the elbow distribution differences. So those are the differences. Now we use shift data identified. So we want to somehow evaluate the or quantify the shiftness, how do those shift data affect the performance, the model performance. So we have sort of 2 ways. One is the indirect way, like we want to cluster the because we have already got the normal score for each external sample, and then we try to, based on the normal score, we will cluster the samples into different groups, small groups, and the clustering method is k-means. The way that we can evaluate them into group in group level, not just each sample level, because it is really hard to evaluate or quantify each sample inferences over the whole data set. So that's the reason. And then we, with those, for example, with this external distribution, we use the elbow method to determine how many groups we want to group to cluster them in. So in this case, we pick 5 as the group numbers, and then by those are the 5 groups. Like the first one is the one with the lowest normal score, and the bottom row is the one with the highest normal score. So you can see how different those are. Because our model is based on reconstruction, so for those images with low contrast, we'll have tend to have lower normal score. And those so you can see here, those images are with very high intensity value, which are very different from Emory model set, and so that's why they are with very high normal score. So this is the thing that when we try to quantify the shift data. So we after we have grouped them into groups, cluster them into groups. We need to we want to train a classifier in the internal dataset, and then the internal dataset will this classifier will learn how to classify them, have some performance reported, and then we will just share this model to the external sources and try to run on the external dataset. And at the beginning, we will run on the whole dataset. And at the same step, we will drop 1 group for each class that is with the highest normal score, because we think high groups with highest normal score will affect the model performance in heavily. So that's why we drop them in this order, and until we have only 1 group left. So in this case, eventually we will at the same time we will record the model performance, the classifier performance. And then we will see the differences. So here, let me say, this is a table, we have both, we have the classification on model set. We have both our model and FN again, which is also a normal detector in comparison. But right now, I only will talk about the CVD part. So Emory test is the internal data set. You can see here. If you look into the hand class, you can see, if you just look into the AUC score, you can see this is the performance we can get in the internal dataset. And for the external one, you can see here, if we use all the Stanford dataset, we can go there. We have very heavy performance drop in here. And if we drop 1 group, so top 5 means we use all the 5 groups, and top 4 means that we we drop the group that with the highest anomaly score in regarding the hand class, and then you can see the performance is improving as we are dropping some like shift data, and then we are gradually getting more and more better and better performance. You can see here. So which means that the shift data actually will affect the model performance, and the shift data probably in the future, the domain experts should look into those groups and do something in the future. So we also developed a portal, like an interface to help the radiologists look into those images. Like besides, we also have the chest array images dataset to be evaluated. So, but now I just talk about the moral dataset, and then if you if you are interested in our interface, you can go to the YouTube link, and then you will have the chance to see how it works. And then we have moral dataset and also chest array will be showing in the YouTube video. So except for the indirect shift data shiftness quantification, we also have the direct shiftness quantification approach, which is by checking the dataset quality directly. So we utilize this OOD metric, which is recently proposed metric that can calculate the similarities, or you can see the distances between the classification datasets. So right now we have the Stanford Mora and also Emory Mora dataset. They have the same classes, so we want to calculate the distances. So this is the plot that's showing the distance, those distance differences when we try to drop some shift groups. And so those axis represents the how many groups we are using. The y-axis represents the dataset differences, the distance. A low distance means the better quality, closer to the internal dataset. So we keep the internal dataset as the same, but we will gradually drop the shift groups in the external dataset. And then you can see for the first one, after dropping the first shift group, we got very high performance improving. Like you can see the dataset quality improves significantly. And for the second group, we still got some improvements, but not that significantly like the first group. So, but eventually we got some quality value like here. And then for FNOGAN, we also can get some the quality improvements, but it's just not that significant or like that obvious. So this is a mass shift, like the shift data identification. We have talked about how to identify the shift data. We talk about how to measure the quantity, the shiftness, and with those results, we will, since we have already detected the shift data, the domain experts may want to look into the results. And then because we have a lot of data, a lot of samples here, we want to maybe it is like better if we can do something to help them do like a query or something else. So that's why that's motivate us to do the outlier sensitive content-based image retrieval. The task is to retrieve radiologist images in external datasets. Since the external datasets may contain a lot of noisy data compared to the clean internal dataset. So if we can do something like the retrieval model can also get some awareness of intra-class variation, that will be like a more sensitive to the outliers, and then we will get better retrieval performance. The background is that knowledge data with significant intra-class variation very common. Like I said before, if we look into the more data, you can see even for the hand class, we have different variations. We have the different qualities. So those are the noisy data, and we want to do some retrieval there. But currently, the methods can only care about the class-wise retrieval. They only learn the interclass similarity and consider the interclass variation, but they cannot they just ignore the intra-class variation for a long time. So that's why we want to do this. But the challenges here are first, we cannot get any intra-class annotations because it is very hard to say this is a bad hand data, this is a very good hand data, or something else. You can define the levels of the intra-class variation. It's very hard. And if we have a very good standards to annotate such data, it also will consume a lot of energies and efforts to create such a data set. So what we do is that we generate the pseudo-label, pseudo-intra-class labels based on the shift work, the shift identification work. And we will consider both the intra-class and the inter-class variation at the same time. Which means that, as I showed before, we have the internal dataset as our standard dataset as a base one, and then we train the anomaly score for each class, and then we share the anomaly score, anomaly detectors to the external datasets, and then we can get some got the anomaly scores for each external samples. External sample, and then for each class, we because we have grouped them into different bins, or cluster them in according to their anomaly score. We class them into different groups. Then we will treat those different groups as the pseudo label. This is maybe G1, G2, G3, G4, G5. Those are pseudo label, and we will use those pseudo label for data sampling. So we propose to sample quadruplets. So we have the positive image, which, for example, this one is a positive image, and then we have the we first have the anchor image, this is the anchor image, for example, and then we will have a positive image that is from the same bin, same class, like the same group, same class, like this one. And then if we consider about the intra-class differences or intra-class variation, those samples should come from different groups, but from the same class. And when we consider about the inter-class variation, those samples can come from the other classes, whatever the groups they are from, but they just are from different classes. So after we got the quadruplet sample, we can feed those data into our feature, like a backbone, like a feature extractor, try to get some imbalance. And then with the imbalance learned, we optimize this model by learning with two objectives, like two losses. One is the intra-class loss, the other one is the inter-class loss. We'll talk about this later. And eventually, we will think about try to get something like here. For example, we have a hand image like this, and the hand image like this, and another one. But we will hope that these two will be far somehow. But in regarding to the other classes, they are also close compared to the inter-classes. Like you have anchor image, you have the positive image, and those are the intra-class negative image. But regarding the inter-class negative image, those intra-class negative image should be treated as positive, just regarding the inter-class differences. So because we are learning two parts, like intra-class class-wise information, and also inter-class-wise information. So usually, because even we consider about this, we are thinking that they are from the same class, they should be the variation should be not so significant as the inter-class variation. So we don't want to like put too much weight on this intra-class like information, while ignore the inter-class variation. So we have some, we balance this learning loss, the two losses, and by optimizing, like enable the anchor image to be close to the positive image, while we have some certain margin to the intro negative images. And also we will hope that the anchor image also close to the intro class negative image, but far from the interclass negative image. And we also investigate how which lambda value will be good for this model training. Like we experimented the model on two datasets. One is more dataset, the other one is chessboard, which is a chess has image dataset. And with trying different lambda values, the 0.5 to 0.01, we found that regarding the precision recall on different datasets, we found that 0.05 works the best. It always give us a very stable performance. So we think this one is the one that we suggest for later usage. And this is one example that we, for example, this is a hand image. We treat it as a query image, and then we tested for the query. Like we present the query, the retrieval results with different models. The baseline is the deep rank, which is just a triplet based image retrieval model. And the last row is our results. And you can see here, so because those models like fast AP, multi-similarity, circle loss, and the super contrastive loss one, they are all treat the hand class as the same. Like this hand sample is same as this one, so that's why they are being retrieved with the same nearly same opportunity. But for our models, we will first make sure that we can put the those hand data from the same class, same and showing the similar intra-class variation at first, and then some hand samples with different intra-class variations at the end. Then you can see that's.
May I ask a question here?
Sure.
So for each anchor image, do you only select one positive, one intra-class, and one interclass, or do you sample more?
Oh, yeah. So we sample multiple. So we have different quadruplets. So each anchor image you can pick, I think just at least 10 different variation, like 10 positives, 10 other intra-negative, inter-negative. So just get more variation and try to explore the data set as enough as possible. Yeah.
But the positive, the number of positive and intra and inter are the same, right?
Yeah. Yes.
Okay, I see. Thanks.
I think that's all. Yeah. Thanks for my advisor, Professor Imam Banerjee, and my collaborator, Judy, Harry, Jali, and Sabdash, for their help in these works. That's why I'm come here. And thank you. If you have any more questions, just feel free to ask. Thanks.
Awesome. Thanks so much, Sophie. I had a quick question actually, but before we go into questions, maybe we can all give a round of virtual applause for the talk.
Thanks.
In your last project where you mentioned the CVIR, if you go back a couple of slides.
This one?
Yeah, this one. So in this case, are you assuming that you have inter-class labels already, like from the external data set, you already know the differences, like the classification is already present? Or?
Yeah, so we assume that we have got the class, general class information, like this is maybe this is a hand class, this is a forearm or something else. But for the quality issue, we just learned from the anomaly detector, which is totally like unsupervised without any human intervention.
I see. And so the task is to retrieve a similar like class object for a given internal sample. Is that correct?
Yeah. So I think the contribution is more about like the pseudolabel and also care about the intra class variation. Yeah.
Gotcha. Thank you.
Thanks.
I see that you compare your methods to supervised contrastive loss, right? From what I remember, supervised contrastive loss, they also compare interclass and intraclass. Do you have any intuition why, or like what are the advantages of your model compared to supervised contrastive loss?
I think probably that's we have the previous anomaly detector trained and have learned some in-distribution information. So that's why it can identify the intra-class version before we feed those data into our model. But for super contrastive learning, the model may just sample some intra-class. It thinks those samples are showing intra-class variation, but they have no idea about the internal learning. So I think that's why our model may perform well than theirs with the differences. Yeah, just so this is a kind of an extension work of the shift data identification.
I see.
Yes.
Thank you. Any other questions? Mark, do you have a question?
I actually have one more question. So this is pretty cool. So you worked with Neura and Chexpert. Do you have any intuition, or have you tried any experiments with like other kinds of data sets which are not, even Neura and Chexpert are quite well curated. So if we had to use some other data sets, have you tried any of those, and any sense on how it will perform?
For data set curation, right?
Sorry, I didn't get that.
Do you mean like for data set curation work, try different maybe categories, like medical, other types, data types, right?
Yeah, other data types, and maybe like non-chest X-rays or non-Neura and non-Chexpert data sets. Do you have a sense of, or?
Yeah, I think that would be one good way just to extend this work because of due to the time limitation and also the energy. We did actually train the use the MORA, which is X-ray of the body parts, and then chest X-ray, which is just the X-ray of the chest part. We didn't try any other modalities. But we used for chest X-ray, we also experimented on mimic dataset. So we treated the MRI as an internal dataset, and we experimented on both chest bird and also mimic dataset. So we think that's kind of an extension of the not only MRI and Stanford, but some other data sources. But yeah, definitely we can try some other modalities. For example, skin cancer image or some others. We can treat them. One is internal, the other is external. And yeah.
Nice,
Hopefully,
thank you.
I hope I have the time to do that and then show the results.
So I don't know, like Nandita, have you played with Chessbot or Mura dataset yet?
Yes, I've been starting to think about them. So
It's
I
not
probably work on...
really curated data, you know.
Oh, I see.
Yeah. So the first problem is that you can imagine like there are a lot of inverted image, which is still easy to detect. She already handled that. So it's still easy to detect the inversion, but there is also the view problem, you know. So for example, chest X-ray, you can see like the frontal view and the side view. And everything is mixed together, of course.
I see. Do you
and
have
Mura
any
is Mura is even more complicated because you understand, like if I say like hand, so ideally hand is only this up to this portion, you know, but then you will see like different positioning of the hands.
Oh, I see.
But then imagine finger, which is also part of the hand. You see what I mean? Like to differentiate finger from hand, it's not that easy, right? Because most of the time X-ray, imagine like we do chest X-ray or any types of X-ray because those patients we suspect some abnormality, right? Probably the patient cannot move the finger straight or cannot keep it straight, so you get a lot of like anomalies in that sense too.
And is there a sense of like different conditions, like let's say if you have a chest X-ray, like are there
chest X-ray,
fractures?
chest X-ray, there are 14 conditions. The dataset that Sophie was showing, it was 14 different conditions. And another complexity is that 14 different conditions are not like unique. So they are multi-labeled. So one study can be labeled with multiple same conditions, like multiple different conditions. But Mura is not like that. Mura is like independent, you know. So it's a mess, yeah.
Well, thank you. Awesome. Thanks so much, Sophie, again. If there are any more questions, you feel free to ask, or you can also reach out directly to Sophie, and good luck for your defense as well.
Thanks. Nice to meet you. See you all here.
Thank you, everyone.
Thank you.
Thank you.
Thank you.
Bye-bye.